Hi guys, welcome back to my channel Obgyn Made Easy. In today's video, I'm going to discuss post-cesarean section care. A shout out to Abdullah for requesting this topic. And I thank him for that because post-cesarean section care is one of the topics that's overlooked during clerkship. And you find yourself one day as an intern looking after a post-cesarean section patient and you won't know what to do with that patient. So what is post-cesarean section care? This is the care given after cesarean section to prevent post-operative complications and promote normal puerperium. The care is given to both the mother as well as the newborn. So what happens in the first 24 hours of cesarean section? It's important to observe the type of anesthesia that was used. This is because in spinal anesthesia, you have to advise the patient to lie down for at least 4 to 6 hours to allow the spinal anesthesia to wear off. If they get up too quickly, they can have dizziness or post-spinal anesthesia headaches. If general anesthesia was used, you have to advise the nurse who are going to take care of the patient to nurse the patient in the lateral position to avoid pulmonary aspiration of vomitus or food contents. Remember that general anesthesia 1 renders the patient unconscious, 2 it relaxes the lower esophageal sphincter tone, so food tends to regurgitate, and 3 it also relaxes the upper airway reflexes that cause us to cough when food is in the respiratory tract. So the patient at this moment is susceptible to pulmonary aspiration. So it's important to only start the feeds when the patient is fully awake. The most important thing you have to observe the patient for is postpartum hemorrhage. This usually occurs in the first 6 to 8 hours. So you're going to look at the vitals, the blood pressure. A low blood pressure should worry you if there's a high pulse. This could mean that the patient is bleeding internally. You also check for vaginal bleeding. Usually the bleeding should be minimal, but if it's a lot, it should worry you and you should think of postpartum hemorrhage. And also check for the uterus if it's contracted or not. It could be an atonic uterus that's causing the postpartum hemorrhage. It's important to go through the drug chart to see if the medication and fluids you ordered are being given. You check for the intravenous fluids. Usually, it's 2 to 3 liters in 24 hours. You can use Ringer's lactate or normal saline. You might have ordered blood transfusion if there's major blood loss, like more than 1,000 ml. Usually, in a cesarean section, 500 to 1,000 ml is normal. Blood transfusion can also be given if the patient is anemic, like the hemoglobin is less than 8 grams per deciliter. Intravenous antibiotics are given for at least 2 days. You cover the patient on a broad spectrum antibiotics. Generally, a cephalosporin is recommended, and also cover the patient on metronidazole to cover for anaerobes. After 2 days, you can switch the patient to oral antibiotics. It's important to cover the patients on good painkillers so that the post-recovery is fast. Pethidine is usually given for the first 24 hours because it's a strong painkiller. You can also add a diclofenac for 2 days. You only add paracetamol when the patient is able to tolerate oral feeds. One of the most important things you're supposed to do in the first 24 hours is early ambulation. This is to prevent deep vein thrombosis as well as pulmonary embolism. So you start early ambulation as soon as the anesthesia wears off. So ambulation in bed starts after 6 to 8 hours. This is when the anesthesia has worn off and the patient is usually pain-free and comfortable. Generally, the condition is satisfactory to start early ambulation. So ambulation in bed includes lateral turns. They move the legs, knee and ankle joints. This helps with exercising of the legs to prevent deep vein thrombosis. To help the patient ambulate early, you can also remove the urinary catheter as early as 12 hours post-cesarean section. This encourages them to come off bed and empty the bladder. So this helps with ambulation. But you find that in most situations, we remove the urinary catheter on day 1 post-cesarean section. This is because we want to monitor the urine output. The patient can be started on oral sips as early as 6 to 12 hours post-cesarean section. You can start with water or tea. But remember that if general anesthesia was used, you have to wait for the patient to be fully awake to avoid pulmonary aspiration. Why do we start oral sips as early as 6 to 12 hours? This is because the surgery was on the uterus and the bowels were not touched, so the bowels were intact. Breastfeeding can be started in the first 24 hours. So you start breast attachment 3 to 4 hours post cesarean section as long as the mother is stable and free of pain. This is also the time you can do a quick dysmorphic features check on the neonate in case you need to send them to the neonatologist. So the one post cesarean section is after 24 hours has elapsed. So you do a quick checkup on the mother as well as the neonate and see if there's any problems. For the mother, the first thing you do is check the vitals, the blood pressure and the pulse. Remember that a low blood pressure and a high pulse means the patient can be bleeding internally. Temperature will tell you if there's infection or not. Quick examination of the mother includes checking for pallor. So if the patient is severely pale, it means they need blood transfusion, or it could mean they're actually bleeding internally. So you have to correlate your findings with the blood pressure as well as the pulse. And you have to do a full blood count to check for the hemoglobin to see how much blood loss there's been and how much anemia is there. You do a quick breast examination to see if there's milk production. Remember that the neonate also needs to feed. Cracked nipples are very rare at day 1 post cesarean section because the neonate has not yet started breastfeeding as much, but it can happen later on in the puerperium where a patient has cracked nipples. You check the uterus if it's contracting and involuting. So a normal uterus size after post-cesarean section should be about 4 centimeters above the umbilicus or 4 centimeters below the umbilicus. And week by week, the uterus starts involuting. What is involution? Involution is when the uterus starts to go back to its pre-pregnancy state. So week by week, at least the uterus size reduces by 2 centimeters. You expose the wound dressing to check if the wound is dry and there's no active bleeding. You also check for pervaginal bleeding. Normal pervaginal bleeding after cesarean section should be minimal. The pervaginal bleeding that occurs after delivery is called lochia. So lochia is uterine discharge that occurs after delivery and can last up to 6 weeks. This is the puerperium period. The first lochia is called lochia rubra. Rubra means red. So it's blood-stained pervaginal discharge that occurs for about 4 days. The next lochia is called lochia serosa. It's pinkish discharge. This is because it's serous discharge. So it's a bit paler than lochia rubra. The third lochia is called lochia alba, and it's usually a white or yellow-white discharge. This is because it's mixed with leukocytes as well as debris, so it looks a bit yellow-white or white. Once the wound is exposed, encourage wound cleaning. Soap with water is enough about 2 to 3 times a day, or you can use normal saline, but avoid detergent containing soaps. Encourage full ambulation. If you have not yet removed the urinary catheter, you can remove the urinary catheter this time on day 1. Check the output charts for urine output if it's adequate or less. For bowel movement, if the patient is passing flatus or opening bowels, at this time you can tell the patient to resume their food diet. You also check the drug chart to see if the medications are being given. This is when you can add paracetamol, and if pethidine was not already discontinued, this is when you can discontinue pethidine. You can also repeat a full blood count and differential count. Remember that in cesarean section there's blood loss, so you have to do a post-cesarean section full blood count to check how much hemoglobin is there. So on day 1 post-cesarean section, you also do a quick neonatal examination. You look at the vitals. A high temperature should make you suspect dehydration, fever, or an infection. Remember that the pulse of a newborn is about 140 to 160. You also check the saturations. You ask the mother if the baby is breastfeeding, has open bowels, is vomiting, or passing urine. You examine the neonate for fever, dehydration features, jaundice, or abdominal distension. On day 2 post-cesarean section, it's the same routine care as day 1, but if they're not opening bowels yet, you can give them lactulose to help with bowel movement. On day 3 post-cesarean section, patients can be discharged as early as the 3rd day if you're satisfied with the patient's post-op recovery. So what's the plan on discharge? You cover the patient on oral antibiotics for at least 5 days, a cephalosporin plus a metronidazole. Adequate analgesia, a paracetamol for 5 days, or an NSAID like diclofenac for at least 3 days. If the patient is anemic, give them hematinics and also advise them on wound cleaning, encourage ambulation, encourage breastfeeding 2 hourly. Advise the patient to not hesitate to seek medical help if the mother or baby's condition changes. So you review the patient on day 6, then at 6 weeks postnatal. By this time, you should have already counseled them on a family planning or contraceptive choice. So encourage family planning again at 6 weeks postnatal. This comes to the end of our discussion on post-cesarean section care. In the next topic, I'm going to discuss postpartum hemorrhage. Please don't forget to subscribe. Thank you.